Okay. Hi.
Mm,
I'm Denise, and I would like to take a moment and say thank you, Sarah, for organizing this event. Thank you.
you're so welcome.
And I'd like to welcome and thank all of you online for joining us. I'm guessing that those who are with us have experienced one or more miscarriages, and I find that whether that loss is the first or second trimester, losing a baby can be very heart-wrenching and difficult in a woman's life. Most of the women that I see feel very frustrated and confused and really want to take every step possible so that they can have a healthy baby. So as Dr. Carey just so nicely explained to you a little bit about the Western point of view, I'm going to share just the tip of the iceberg, just a little bit about how pregnancy loss is viewed from Chinese medicine and how it can help someone who has suffered from miscarriage or prevent future pregnancy losses. So from a Chinese medical point of view, a miscarriage is considered to be almost as taxing on a body's resources as childbirth. During that first trimester, the fetus is growing so rapidly, and it takes a lot of blood and nutrition to support it. And after a loss, the hormone levels drop so quickly, and many times there's also a significant amount of blood that's lost. So this can leave the body feeling weak, not to mention um, the emotional distress, of course. So in Chinese medicine, it's really important to nourish the body and rebuild blood after a miscarriage and before trying to conceive again. So when you go to a Chinese medical practitioner, they'll assess the whole body and see where there's imbalances or dysfunction. And one of the most common issues I find in women who have had pregnancy loss is the quality of blood is not very good. So having healthy blood in Chinese medicine is considered to be very important. So we don't look at just the volume of blood. We also look at the quality of blood. Does it have enough oxygen? Is it enough nutrient rich so it can nourish your cells in your uterus, eventually hopefully the baby? Does it circulate easy? All of these things can make a huge difference in the outcome of a pregnancy. So if the uterus is not being nourished properly, the body won't be able to sustain the pregnancy. So we want to make sure that the blood's healthy. So you have to remember Chinese medicine is a different paradigm than the Western medicine. So we look at things a little bit differently. So I was going somewhere. So we actually ask a lot of questions about someone's menstrual cycle or what else is going on with their system that may give us some idea that things aren't adequately functioning or at optimal, at a subclinical level. So maybe the blood can be thin or watery. If that's the case, we would want to nourish it. Or maybe if the blood is thick and kind of sticky, then we would want to nourish it and make it move. So, for example, some signs and symptoms that may demonstrate unhealthy blood would be like clots in the menstrual cycle or irregular menstrual cycles, pain, some fatigue, and even insomnia. So by using acupuncture, Chinese herbs, dietary changes, proper amounts of exercise, it can correct some of these underlying issues that may be interfering with your fertility. So we really believe that having a healthy blood and a healthy body, making sure that you're eating the right amount of green vegetables, and sometimes you need to eat red meat, or we'll recommend a lot of soups, but homemade soups where you're actually you're getting the marrow from the bone to help nourish the blood, and other types of dietary recommendations that can help whatever's going on in someone's particular situation. And then hopefully with healthy blood and healthy body, you can get a healthy baby. So in order to prevent future miscarriages, you really want to prepare your body to before you try to conceive again. And especially if someone's had recurrent pregnancy losses, we would recommend that they really work with nurturing their body for at least around 3 to 6 months. Average is around 3 months. That, of course, that's a generalization. Everybody's situation is different. You have to take into a lot of factors as far as your diagnosis, your age, and what else is going on with you. Okay, so you also want to make sure that you give your body the assistance that it needs in order to be able to retain the baby until it's born. So that could be sometimes medication, making sure you're giving it enough rest. When people are stressed, and if stress doesn't ever stop, then the cortisol levels increase. And there's been some studies to show that with high levels of cortisol, it actually decreases your progesterone, and progesterone is really important in sustaining a healthy pregnancy. And acupuncture and exercise, therapy, learning how to do those coping mechanisms of stress are really important. So acupuncture has had many studies to show on how it can possibly help with fertility, and some of the main studies are increasing blood flow to the uterus. As we age and as we stress, the blood flow decreases from the reproductive organs. So that's where it can be really beneficial. It also helps balance your hormones of estrogen and progesterone, which are the hormones that are important for nourishing the uterine lining, and progesterone in order keeping it thick and stabilizing the pregnancy. And then it's also great for just stress reduction. And acupuncture has a cumulative effect. The studies show that it takes usually they say 5 to 7, so 6 treatments before there's actually a physiological change within the uterus. So people usually feel better right away, but in order to get that accumulative response, there needs to be a couple of treatments. And they've had studies show that it can last once you've made those changes. I don't remember if the follow-up was 3 months or 6 months. But even without care, after that change has been made, your body is able to sustain that. I put this male infertility slide just because I find that it's important to remember that the men have a big part in this. I find that for some reason, a lot of couples that come in, the woman is carrying most of the burden, and I can understand it's the woman, the host, so she's going to be carrying the baby, and she's the mom, so that makes sense. But as far as the genetic material, it's really important that the males are also being healthy. Some of the things that Dr. Carey recommended is avoiding the alcohol, the caffeine, not putting cell phones in the pocket, taking certain supplements to make sure that their sperm is as healthy as possible too. So there is hope. We find that the goal with Chinese medicine is to prevent miscarriages, and we can realistically say that Chinese medicine is useful in the treatment of treating recurrent miscarriages, because we're treating the underlying condition of the potential parent, not just the pregnancy or the fetus. There has been some clinical results of treating threatened miscarriage, but that would only be if the genetic abnormalities, if that wasn't the case, if for some reason the pregnancy wasn't doing very well, nourishing the fetus to grow. So I just want to recommend everybody stay strong and keep moving forward. And if you have any questions or like more information, I'd be happy to help. Thank you.
Thank you, Denise. That was really an excellent presentation. You have such a healing energy. I know that I've referred my clients to you, and we have clients in common. and everyone comments on that, that you have a healing and a soothing energy that they so appreciate. So thank you.
Thank you, Sarah.